Okay, let's dive right into this explainer. Today, we're unpacking the hidden ticking clock of deep vein thrombosis. It's a condition that operates totally quietly, completely out of sight, right up until the exact moment it becomes an absolute medical emergency.
So imagine this for a second. What if sitting perfectly still was actually the most dangerous part of your much-anticipated vacation? You finally settle into your seat for a long, relaxing cross-country flight, you put your headphones on, and you don't move a single muscle for hours. You think you're resting, right? But inside your body, that prolonged immobility could actually be triggering a life-threatening medical event.
To understand why, we've got to define the beast early on. Deep vein thrombosis, or DVT for short, is a serious condition where a blood clot, medically known as a thrombus, forms inside a deep vein. And this most commonly happens down in your legs. Now, localized blood clotting is usually a totally normal, essential protective mechanism, but an unprovoked clot deep inside a major vein, that becomes a highly dangerous biological roadblock.
Here's our agenda for this explainer. First, the anatomy of a blood clot. Second, Virchow's Triad and its triggers. Third, symptoms and pulmonary embolism. Fourth, diagnosis and medical treatment. And finally, recovery and prevention strategies. Let's get into it.
Section 1. Anatomy of a blood clot. Let's see exactly where this takes root.
So, here are your primary deep vein target zones. Most commonly, these abnormal clots form in the lower body. We're talking about the calf veins, the popliteal vein directly behind your knee, the femoral vein running through your thigh, and the iliac vein up in the pelvis. Interestingly enough, the left iliac vein is actually way more prone to DVT than the right. Why? Because of anatomical compression from an overlying artery. It's a condition known as May-Thurner syndrome. Occasionally, it can happen in the arm veins, but that's a lot less common. You see, these deep veins are essentially massive biological highways, and their whole job is pumping deoxygenated blood back up to your heart and lungs, constantly fighting against gravity. So when a clot forms in one of these specific zones, it essentially barricades that normal upward flow.
Moving on to Section 2. Virchow's Triad and triggers.
Now, this provides the exact medical blueprint for why a clot forms in the first place, known as Virchow's Triad. It basically outlines three main villains. Villain number 1 is blood stasis, which is slow or completely stagnant blood flow. Think of it literally like highway traffic suddenly coming to a dead halt. Number 2 is blood vessel injury. This could be from major surgery, fractures, or blunt trauma. It's like severe physical damage to the road itself. And the third villain is hypercoagulability. This means the blood becomes unusually prone to clotting. Imagine the actual cars on that highway suddenly getting covered in superglue, sticking to each other like sticky asphalt. If you've got one or more of these elements in play, your risk absolutely skyrockets.
But what actually triggers these three villains in the real world? Well, the major risk factors include being over the age of 60, obesity, smoking, cancer, pregnancy, or having genetic clotting disorders. But the one we really need to highlight here is prolonged immobility. The countdown often begins during completely everyday situations. We're talking long car rides, long flights, or prolonged bed rest after an operation. These seemingly harmless moments of stillness, they are prime triggers for blood stasis.
Section 3. Symptoms and pulmonary embolism. This is where it becomes a systemic crisis.
So, if a clot is forming in your leg, your body might actually send up some localized DVT red flags. These physical warning signs include swelling, and this usually only affects one leg. You might feel a deep cramping, aching, or extreme tenderness down in the calf. The skin over the area might feel unusually warm to the touch. You might see visible redness or discoloration, or even notice enlarged, prominent superficial veins pushing right up against the skin. But here is the absolute most terrifying aspect. Many patients experience zero symptoms while the clot steadily grows. It can be completely silent.
And if that silent clot goes unchecked, it begins a very dangerous journey, resulting in a pulmonary embolism. Let's break this complex internal failure into a step-by-step story. Step 1. A piece of the clot physically breaks away from its home base in the deep vein of the leg. Step 2. It travels upward, literally surfing through the major blood vessels of your body. And step 3, it gets pumped right into the delicate, narrowing vessels of the lungs, where it instantly lodges, choking off blood flow and oxygen exchange.
When that happens, the localized leg problem instantly becomes a life-or-death situation. Pulmonary embolism, or PE, symptoms hit incredibly hard and incredibly fast. We are talking about sudden, unexplained shortness of breath, sharp chest pain, a rapid heart rate, coughing, sometimes even coughing up blood, and severe dizziness or even sudden collapse. Let me be incredibly clear about this. There's no waiting to see if it gets better. This is an absolute medical emergency requiring immediate 911 intervention.
Section 4. Diagnosis and medical treatment. Here is how we fight the clot.
When a patient hits the hospital, doctors have to act fast. And here is exactly what their diagnostic toolkit looks like. They might start with a D-dimer blood test. This is a fantastic screening tool that essentially looks for tiny clot breakdown products floating around in your blood. But to actually see the physical problem, the Doppler ultrasound is their absolute go-to weapon. This piece of tech brilliantly visualizes the blood flow in real time, letting doctors detect the exact location of a deep vein clot. Now, if they suspect the clot has already traveled to the lungs, a pulmonary embolism, they'll immediately jump to a CT scan to map the chest and pinpoint the exact blockage.
Okay, once the clot is found, we've got to treat it. And we really need to clear up a massive public misconception right here. Doctors primarily use anticoagulants. You probably know these as blood thinners, like heparin or warfarin, but listen to this. These do not instantly dissolve the clot you already have. Actually, scratch that. They don't dissolve it at all. Instead, they prevent new clots from forming and stop the current one from growing. This gives your body the time it needs to naturally break down the original blockage. On the flip side, we have thrombolytics. These are the intense clot busters. They're powerful medications used to actively and rapidly dissolve existing clots. But because they carry massive bleeding risks, they are strictly reserved for only the most severe, life-threatening cases.
Now, when medication just isn't enough, surgeons have to step in. A thrombectomy is the actual physical surgical removal of the clot right out of the vein. Alternatively, doctors might install an inferior vena cava, or IVC filter. Think of it as a tiny metallic umbrella placed in your main abdominal vein. Its whole job is to physically catch any breakaway clots mid-journey, stopping them before they can ever reach the lungs.
Section 5. Recovery and prevention strategies. Let's talk about long-term healing.
Recovery relies incredibly heavily on physiotherapy and compression. Early mobilization is absolutely key here. Walking programs get that blood flowing again. Physiotherapists will guide patients through simple but incredibly vital movements, things like ankle pumps, calf muscle exercises, and deep breathing routines. And right alongside this movement, compression stockings act as your ultimate physical shield. By tightly squeezing the legs, they forcefully improve blood return back up to the heart. This heavily reduces swelling and drastically lowers the risk of further life-altering complications.
And those complications are exactly why preventing recurrence is just so vital. I really want to warn you here, while many people recover perfectly from DVT, some develop what's known as post-thrombotic syndrome. This is a severe, long-term complication caused by permanent damage to the valves inside the vein. It causes chronic, lingering pain, persistent swelling, skin discoloration, and in severe cases, open leg ulcers. It is a lifelong burden and one that we want to avoid at absolutely all costs.
So let's bring this right back to your everyday life. Here are the precise, actionable steps you can take to diffuse Virchow's Triad on your very next flight or long car ride. Consider these the traveler's prevention rules. First, walk regularly down the aisle. If you're stuck and absolutely can't stand up, perform seated ankle exercises, literally just pumping your feet up and down to flex that calf muscle. Next, stay thoroughly hydrated. Remember, dehydration makes your blood thicker and stickier. And above all else, avoid prolonged, uninterrupted sitting. You have to break the stasis.
Which brings us to our final provocative thought. Now that you know the hidden signs and the silent countdown of deep vein thrombosis, how will you move on your next long journey? Remember, simple movement isn't just about stretching your legs. It is quite literally your most powerful, life-saving tool against a totally silent threat. Thanks so much for joining me for this explainer. And hey, remember to stay active out there.